this as well. This is an amalgam well. You put your amalgam, once we mix it in this triturator, you put that in here. You're going to put your finger underneath the carrier, and you're going to push in and pull on the sides, and that loads amalgam in here. Then you transfer it to your doctor. When you pass this, you need to have your condenser in the hand, and then you'll be doing the assisted switch, grabbing from your pinky, things like that, and handing off. We also have the burnisher, so a ball and football burnisher. Looks just like it, and then there are two carvers. Hollenbach carver has like a little pointy end. That's not a refining instrument. Our refining instrument for this particular setup is a GMT. And then we have a discoid cleoid and a Hollenbach, so that's on this setup as well, if you don't know what those look like. We also have the small liner or ball applicator that places that. So we are using dical. Make sure when you get dical or a liner that says dical, calcium hydroxide is what he technically is. Dical is just the brand. Calcium hydroxide, hence its name, calcium rebuilds dentin. Do you remember me talking yesterday about getting close to the pulp? If we happen to get close to the pulp, then we will put this liner in here, which promotes secondary dentin. So we're actually asking the body to build more dentin and keeping the pulpal floor lower, so we don't expose any pulp. If we have a pulp exposure, we can't do amalgam. We have to go immediately into root canal. So we're preventing that. So that's what this liner is for. So hence the name calcium. Calcium hydroxide is his name. So remember, calcium builds. So that's what he does. We also have this copalite. You can open it anytime you want. It smells like horrible nail polish. This is the varnish that we use, which seals the dentin and the liner. So we'll put the liner, put it on there, and then we'll use this. You have to make a cotton pallet. So you're going to pull apart your, what is this, cotton wool? And you're going to just pull a little bit apart, roll it into a ball, and then you're going to put it in there. Usually we have a dapping dish. You'll put just like a drop of this in a dapping dish. We don't ever go in, so if you have two, you need two of these, because we could just dip it, because we don't ever go in twice. One dip is enough. Then we'll use this, smear it on all the surfaces that are in the prep, and then I'll burst some air to smooth it out or thin it out, and that's how you do that. So that's varnish. It stinks really bad. I have, just in case, we're gonna, do, let's say we have a big MOD and we are close to the pulp. So I brought IRM just in case we need to stop what we're doing and temporarily fill our tooth, because we are very close to the pulp. If we're very close to the pulp, this won't help. So we'll put some temporary restoration inside there and see what the tooth is going to respond. So if we are very close to the pulp, we put the temporary material in, because as usual, so usual is a soothing effect to the pulp. So we're going to see how the pulp will react to the big giant cavity. Will the tooth be okay, or will the tooth act like it's dying? So we're going to find that out. We'll send the patient home with the IRM placed inside the tooth for about 2 weeks, call them back and see what the results are. So if they have had pain in the tooth, or the tooth is just really achy, that's probably a sign the tooth is going to die. If the tooth maybe had just sensitivity to cold and air or whatever, we might be able to fill it in 2 weeks. So we're just testing the pulp and see how well it lasts. On our burr blocks, you're also going to see, it's going to intermix, just in case you grab just any burr block on my cart. So any of these burr blocks are going to be the same burrs, basically for amalgam or composite. You will see furnishing burrs on there, and you'll need finishing burrs for any type of restoration, just in case you have like an overhang or material, especially for composite, we cured in the wrong position. So it creates another shelf or line. So we have some of that stuff on there. So take a picture and study those. I got my Toppelmeyer ready to go, just in case we're doing an proximal surface. And then right now we're going to rubber dam our patient because our patient just presented. Do the same things over again. Any changes in your medical history. Make sure he signs a consent form. And let them know about the procedure. We're going to be working on with Amalgam. You always want to let them know what you're doing, especially during a restoration, because at this point, a patient could be like, well, I don't want any silver in my mouth. And that matters a lot. So if he says, I don't want any silver in my mouth, obviously we're going to probably switch our setup to composite. They'll usually mention that in our first visit once we're talking about the full FMX, diagnosing the teeth. They're like, what kind of restoration do you want? Do you care if it's amalgam since it's in the back tooth? Usually they'll say, yeah, because it's cheaper. So amalgam is way cheaper than composite. But some people just don't want metal showing in their mouth at all. So, all right. So we will begin. I'll just get it more closer to you. Yes. So we'll start off with number 1 says basic pass, right?
Yeah.
All right, so since we're amalgam, it's going to be at a posterior tooth. I got a good tooth here. So we're going to work on tooth number 19. Yeah, top step 2 is topical, correct?
No.
Yeah.
You write it. It says dry buckle fold with 2x2.
Yeah. We are on the same.
I'm like, wait.
Yeah, no, I was all waiting for that. Okay, then we dried our buckle. We got to dry the buckle because the gingiva would adhere the topical gel a little bit better. So the gums can get numb for this needle. And then pass your anesthetic. New students, when you pass this, make sure that when you pass, my finger goes into the hole and my fingers come around like this, so I got a good grip on it. All right, she rinsed and dried. Now we're going to put our rubber dam on. So let's punch a hole for 18, 19, and we're going to extend to 21 because 20 is actually missing. 24. Yeah, so you need a pen. Here, I got a marker.
So how many holes do you want us to punch?
So we're gonna, usually it's 3. You'll punch the hole, that's the anchor tooth. So that's gonna be number 18. Number 19 is just gonna have the hole so I can access the tooth. And then 20 is actually missing, so we're gonna punch that. And then 21, so that's our 3 holes, but 20 is missing, so the hole's not even gonna be on a tooth. Does that make sense? There's technically 3 holes, but there's gonna be 4 punches. So we're 18, 19, 20, 21. Yeah, finger last. So if you're sitting your patient, you got the consent form signed, you have topical gel in, and you're waiting for your doctor to come into your operatory to get the patient numb, you should have the dam punch and your anesthetic setup and Toppelmeyer setup. But that's okay. We don't have a clamp? Oh yeah, we need a clamp. Yeah, sorry. Will you give me a posterior clamp? Okay. Don't forget to, we'll tie our bow with floss, so just in case it pops off my tooth, we can catch it. Yeah. So she just asked, how do I want my clamp to be passed? You want to pass it ready to go, ready to open, or ready open like this. So all I have to do is just place it on the tooth. Again, we're going to anchor tooth number 18. Actually, what's it? I know some people teach differently. I was never taught to put the dam on first. I was always taught to put the clamp on first. Some doctors will get picky and say, no, this is the only way you're supposed to do it. But there's not a precise written way to put on. Does the dam go first? Does the clamp go first? As long as you have the clamp at the gingival third, we will be okay. So I'm flossing all my embrasure or my proximal area, so the septum of the dam is inserted proximally. Yep. All right, my patient can breathe, nose is ready, my patient is numb. And we are actually not going to prep this tooth, we're going to prep this tooth so it gets me prepared for my next one, okay? So if you're wondering why we're working on the chest, that's why. All right, so yep, we will prep the tooth. So I'll get my 557. Yeah, right. Oh my god, this offset. Let's never set this off up again. And this one's stuck. Let's just take it off. Go back to the
cold.
Yeah, the stuffing is cold. Alright, I need this one more. We're having water technical difficulties, so we're trying to make it work. Okay, so we're doing an MO. So our prep is, let's do our slow speed. Almost done. I got 2 teeth to prep, sorry guys. Okay, what's next?
Spritz and dry inside tooth. Pass slow sweep, blow air only and use HVE. Pass spoon excavator.
Alright, so the spoon is for if we have any decay left over from any of the burrs. We just want to make sure we hand cut it out. That means it's going to take less tooth structure away. Then we're going to refine, right?
Mm-hmm.
We're going to refine the margin. The GMT. So then, just going to make sure that's even there. Even on the walls. Okay. All right, next.
That would be spritz and dry. Pass Talcumire.
Here's having water technical difficulties. Anytime you see her cup, you're just rinsing. Pretend sage or the airwalk. Okay, so she's gonna pass me my top of my band. So if you load it to the right side, it will work right, right, left, left. Smile up. Let me see your smile. Okay. Move your box to the U. The inner knob. That. Yeah. Yeah, tighten the outer knot. Hold this one so that one's moving. Hold that. Keep it there. Okay, so since I have the rubber dam on in place, I have to make sure, again, that my Tafelmeyer is gonna sit in my sulcus. I need it in the gut tissue. Yeah, so the doc will place these, unless he has an emergency he has to get up from the chair from, then you will either place your rubber dam, Tafelmeyer. If he has something he has to do, he'll let you do it, and then he'll come back and finish. Make sure it's super tight. All right, so steps for the Tafelmeyer are not listed. Okay, it just says place Tafelmeyer on tooth, right? Okay, so I place Tafelmeyer on tooth. Make sure I'm in the gingival sulcus, meaning the tissue of the gums. Now we're gonna, well, we're missing number 20, right? So we can't wedge the mesial since we're working on an MO. So what we'll do is we're gonna create the contour. So you're gonna pass me a ball burnisher. And what I'm gonna do is I'm gonna flare out my mesial, trying to create a thin layer here of metal, and I'm pulling it out as I burnish my band, creating a round surface. Okay, so we are pretty round. We can't wedge. Make sure my band is super tight since we can't wedge. You can't wedge if you're missing that tooth. That's why you can't. Plus, there's nothing to pull apart, so because I'm missing the tooth. Okay,
So
but every other teeth that have adjacent, any proximal surface will be wedged. Okay, he's different. That's because he's just missing 20. All right. So my next step.
It is you do the wedge, pass liner base, hold, drive 2x2 gauze.
Okay, so this is what you're going to mix Dycal on, this little mixing pad. The reason being is we're going to put dots this small. Watch. You don't need it this big because look at the size of this ball. That's what we're going to put, how much material we're going to put in the tube. So it's like barely nothing. Cecile, right in that cabinet right there, give me some Dycal material, make sure the colors match, and it says catalyst and base. Thank you. So, see that little teeny dot? That's all we're going to do. And Dycal is the same equal size. Yeah. Yep. Remember, right next to it, not on top, because once you put it on top, you're activating chemical. So side by side, she's going to mix it. And then you're gonna put this in your hand, also, and then you're gonna pass this. Yep. So she's passing me the liner. cherry mixed, and I take literally that much. Okay, and then I'm going to place it on my floor of my prep. I might dip twice if I need more.
The applicator.
Just a little packet.
Yeah.
Well, what I grew up knowing his name, grew up meaning dental assistant, his name was Dykel.
Okay.
Dykel. There you go. Okay, we're all done with that. My next step. And then look in the mirror. Can you see how much material I actually placed in there?
Yeah.
It's very, very thin. So it's very thin. So make sure it's always little, okay?
What did we make us try?
So you would wipe it. So you see how I dropped it? You see I'm an Edda. I forget things.
That's what that's for.
Yeah. She was supposed to wipe it. I wiped it myself. I forget I'm not an Edda. I'm a doctor right now. Okay, next step.
Pass varnish pellet on a cotton pellet, lightly blot it.
Yeah. I brought 3 different bottles out just so you see that it can come in any type of bottle. It'll say Copalite on it.
Copalite.
That's our varnish, okay?
So this is the one with the little pliers.
Yeah, so this is my cotton palette. And then all I'm going to do is wipe it. It's like clear nail polish basically.
And can you remind us again what it does?
It seals all the dentin tubules and enamel tubules. So we just placed the liner. Now we're going to seal everything to make sure that medicine's going to take effect.
All right, and then the liner itself is like the medicine, right?
The medicine to promote secondary dentin. Okay, so since I don't know how thick or thin that cotton palette was, I'm just going to lightly bunch some air. Your doctor will do this. Even if you don't remember, you can always ask, would you like the air? Would you like me to burst air? So you'll need a little bit of air. We're only thinning it out. That's all we're doing. We're not drying it. We're just making sure that it's even on all the sides. Okay, the next step.
Mix amalgam, place in well-load carrier.
Okay, so this machine is set up to 20 seconds. If you mix this amalgam, this is amalgam, okay, one side of this has mercury, the other side has that alloy, metal alloy. So, once she puts it into the triturator, there's one in there. Will you take that out and shake it, make sure there's some in there? Yeah, or force it out. There you go. Okay, so yeah, put that back in. Please check your timer each and every time you go to mix. Right now it's set on 20, but I've been in dentistry for 14 years. The manufacturer says 20 seconds mix time. But once you put 20-second mix time, you're gonna have a hard time putting it in your carrier. So we're just gonna reduce the amount to 10. Now we have some time to pack and condense. So I'll have you mix this one at 10, yeah. Mix at 10, and then you're going to press start. Yeah. With this triturator, this one is very nice. In 14 years, I've never seen an amalgamator with a lid. This one has a lid. If you look at all the other ones, they don't have lids. They come apart. That's how they are all the time. So when you're mixing, hold your lid just in case it's broken like that. If it's fixed, fine, it works perfect. If it's broken like that and it triturates, that thing will fly off. And then now we have the capsule is able to fly as well. So make sure we just protect them. So I just wanted to point that out because in 14 years, every office I've been in, it's always been broken. Too many hands touch it, that's why. Yeah. And the way you open this carpule, you're gonna twist and pull.
Can you turn this
Tap it real quick on the side to make sure all of it goes to one side, and then twist and then pull apart, and then she's gonna load it in my well. It's not very easy, guys, huh? Tap it in. There we go. All right, so don't close it, because if you close it, you're gonna probably remix that again. Okay, so always keep it open. And then this part, there's a little plastic piece that goes in there that actually contains That's what separated the alloy and the mercury, so this guy. So all those pieces have to get loaded into the closed container with fixer, and then you're gonna load this. There's this side's only one side working, this one's broken. Okay. Press down and pull up on the side so you condense it in,
Pull up on this
like this. Okay, I've been yelled at a lot with amalgam. Some doctors always have something better than you. They'll tell you all of it. So remember I said put your finger under? You're gonna press down in the center and then pull up, like that. And you're just forcing amalgam in. That's one way. Another way, doctor says you're loading it wrong. He wants you to do circles at the bottom of your thing. I don't know. They both do the same thing, okay? If your doctor wants you to do circles, do circles. All right, so next thing you need in ready position is your condenser. So as soon as she passes me this, I load my prep condenser, keep continuing, yep, until we're full. So you gotta watch the tooth just as well as you're watching everything else, because we only stop when we're full, so you might have to mix both of those, okay? So if she notices she's running out of amalgam, I just gave her permission to mix as we go, just to make sure this prep is gonna be full. So I'm seriously pushing down. And that's it, as much, yeah,
So you can go back and forth with this.
until we're full. So before you mix, you see how I just wanted to make sure my assistant passes me the condenser so I can work while she mixes. An MOD, okay, so some of these little capsules are set up to, it's called a spill. So one capsule could usually one spill, meaning one surface, is kind of a good way to look at it. Some of these capsules have what we call double spills, so two surfaces. Anytime you have two surfaces, I always bring 4. Does that make sense?
Yeah.
I usually take a capsule per surface, but I'll take 4 just in case I need more, so I don't have to ever get up and lean. So that's a good rule of thumb. So no matter how many surfaces you have, so if it's an MOD, you're gonna grab 3, grab an extra 2 just in case. Because what if that cavity is really ginormous? So you wanna make sure you have more than enough so you don't have to tell your doc, oh, I gotta go get more. And then now we're halfway full and he's like, oh my God, why couldn't you just bring 1 more? So that's what he's thinking in his head. So always prepare to get more than that. If you don't use it, fine. We can spray wipe spray the outside of the carpio, put it back where it goes, and continue to use it. Do you have any more? Yeah. I'll take it. It's always good. So she checked in with me. She's like, you look kind of full. You're going to need any more. Actually, underneath this cusp, I have like a little slope. So I make sure we fill it all the way. Always ask your doctor if they want more or where they're good or whatever. You never know. No, we never do. Okay, so I'm condensing as well as I can. At this point, my next instrument should be what, a ball burnisher?
Yep.
Okay, so when she passes me the ball burnisher, you should have your suction in your hand. And then from this point on, that suction should never leave. Because this is called moving amalgam, so I'm going to smooth it first. So, I'm going to just create my line. My next instrument should be an Explorer. So, I know you guys can't see me, but what I'm doing is going around the tooth and the band and releasing all that amalgam around there. Basically removing the extra material away from my band, so when I take off my band, my whole cavity don't come out with it. Then I should be released my copper mire, correct?
If you do cotton pliers.
To remove the wedge, we don't have a wedge.
Good. And then, yep, matrix band.
So as an ETA, I take my mire away from my band because I'm going to use my band proximally. So when I pull it out, I'm pulling out just my distal since I worked on the mesial, and I'm going to kind of slide it like floss to take any edges away from the tooth. Don't forget they're numb. Okay, so I kind of created a smooth curve by pulling the metal. Okay, so next it should be my Holland back. Okay, so if I had a proximal tooth, I would stick this proximally and I would cut anything away. And then there should be my discoid cleoid and my bald burnisher. Those are best friends, so make sure those two coincide with each other. So pass me my discoid. Next, what's my next step?
Spritz dental sand to remove
Yep.
debris, pass clamp forceps, remove bands, fresh and melt.
Okay, we'll remove the dam. I turn my face because any spit or saliva would splash right on me. Alright, so now we should be,
Floss,
we'll floss our proximal, but we don't have proximal.
so, and articulating.
Okay,
Straight contacts.
Well,
check our bite. Now we can adjust amalgam since it just was put on with a burr. So if we have to adjust, if it was high, it would be the discoid cleoid again and ball burnisher back and forth. Then check bite, same thing, over and over until we're even or low. Okay, so our patient has a good bite. Now what?
post-op.
Okay, what does our post-op say?
Please do not eat until the anesthetic wears off. It will take about 24 hours for the restoration to completely harden, so please avoid eating on that side. It is not unusual to have a little sensitivity to hot and cold for a few days, and I will escort you up front to make your next appointment.
Make sure they know when they floss to put it down and pull it through for 24 hours. Nothing sticky, nothing hard. Maybe give examples of food. Because this is amalgam, this is not hard yet. It's still soft until 24 hours. Okay? All right.